Yeah, guys, my name's Chris Johnson. I'm a veterinarian here, not in Lexington. I'm living for sales and working for sales, but it's the same thing. And I work on horses for a living. That's just about all I do. Occasional llama, but mostly horses. We are here today to X-ray her feet. Now, that's not really proper to say, well, we're going to X-ray her feet. X-rays are what you use to radiograph something. We're going to produce a radiograph of her feet. So we're going to use X-rays to produce the radiograph, but we're going to do that. You guys have all seen she's got problems with her back feet. We're going to X-ray the bones to see what kind of shape the bones are in, to see if there's any underlying bony problems to why she's having these problems with infection and blowing abscesses out of her feet. Because she blew an abscess out of her right hind foot as well over the weekend. So the way we're going to do that is she is tranquilized, so we give her some sedation so she's not trying to kick us or kill us, step on us, etc. And they're a lot more obedient when they're tranquilized. But and that's just for safety purposes. Then we're going to put her up on these blocks here, like you see here, and that's to raise her foot up off the ground so we can get the whole foot X-ray. And then we're going to take the cam, put the plate behind it. We have a digital X-ray system here, which here's the plate. That's the X-ray plate, and this is the X-ray camera. This camera produces the X-rays, so we'll put the plate behind the foot, aim the camera on the foot, shoot the X-rays, and it'll produce the radiograph. X-rays, I mean, it's radiation, so it is it's cumulative, and it can be harmful if you get enough radiation over time. So we wear lead gowns to protect our innards, and we wear lead gloves to protect our fingers and fingernail beds. And you guys, we're going to kind of go through how we're going to do it. I'm not actually going to shoot the X-rays, and you guys are going to move over behind that brick wall. We're going to shoot the X-rays, and you guys can come back and we'll look at the X-rays and go over them. Okay? Anybody got any questions? Who has horses? 1, 2, 3, 4. Okay. Good enough. Draft horses or riding horses? Riding horses? Okay. Good enough. We're going to get this done, so I'll tell you what, if you guys want to go ahead and start making your way, and just stand in the wash rack over behind the brick, and it won't take us, maybe take us 3 to 5 minutes to X-ray, and then we'll call you back over. On her left hind foot, this is the radiograph of her left hind foot. And this view is what we call lateral to medial, because that's how we shoot it, outside to inside. Lateral means outside, medial means inside. Go ahead, Dr. Stanley, go ahead and put the plate like we're going to shoot a lateral on that. So she stepped off the blocks, and I'm not going to go through the trouble to put her back on the blocks, but this view, that radiograph was produced that radiograph was produced like this. So that you're seeing the side view of your foot. Okay? And when you go look at your skeleton there, you guys have, you'll get a better idea of what it looks like. This is what we call a dorsal plantar view. Dorsal means in front, and we're talking about the horse. Dorsal means in front, plantar means behind when you're talking about a back leg. So the way you produce that image is this one. So now you've got 90 degrees, you've got a 90-degree view, you've got one from the side and one from the front. And that gives you a lot of information about the health of the bone of that foot. Okay. Go ahead. Let her go inside. Now if you guys kind of want to gather around, it's going to be kind of hard. Somebody probably have to squat down, but so you can look at the screen. Okay. And you can take off the package. Y'all see. Okay. So this is these are side views of her left hind foot, which is the foot that has the big cut in it that she's healing up from. And you can kind of see that here. This is her hoof wall. This triangle-shaped bone is her third phalanx. We call it the coffin bone because it's in the hoof. It's kind of in a coffin. That's why it's called the coffin bone. This is her short pastern bone, and or her second phalanx. And this is the end of her first phalanx, or her long pastern bone. So we're just worried about her foot and what's going on in her foot. And as you can see here, you see the hoof wall and the front edge, and things that we look for are, does the bone look healthy? Which it does. It's not, the wider it is, the denser it is, or the harder it is. So that looks good. There's no what we call lucencies in it. Lucency means area of soft bone, which would indicate in this case an infection. She doesn't have that. Then this bone back here, if the guys that have horses and have dealt with horses, that's the navicular bone, which in the front feet, not necessarily in draft horses, but in quarter horses and thoroughbreds and your light breed horses, they get a disease called navicular disease, and it affects that bone right there. So her bone looks pretty good here on the most affected leg. She's got a little bit of arthritis in her distal interphalangeal joint, or her coffin joint, which is where the coffin bone of the third phalanx and her second phalanx, or short pastern bone, where they articulate. This joint moves like kind of like a ball and socket joint. Not quite like a ball and socket joint, but similar. This is the view of her left hind foot from front to back. So just a 90 degree. This is her coffin bone, or her third phalanx here. You can see the defect in her hoof is right here. This is her short pastern bone, and this is the end of her long pastern bone. And all of that looks relatively okay. She's a little bit roughened here where the defect is, but no real areas of bad infection in that bone. All right, here's an x-ray of her right hind foot. Similar, she's got these gas patterns in her hoof wall, which is from the abscess that busted out this past weekend. So she ruptured an abscess in this right hind foot Saturday or Sunday. I don't know exactly when she got sound, but generally they're very lame. Why? The abscess is in the hoof, because it doesn't have anywhere to go. It's just pressure. You got bone. It's got bone on this side and hard hoof wall on the other side. So it has nowhere to go, so it builds pressure, and that's very painful. Then when it ruptures, either in the bottom of the foot or the top of the foot at the cornet band, then the pressure is relieved, and those horses generally get much better pretty quickly, which happened in her. So we look for evidence of, again, bony infection. Look for evidence that we have what we call laminitis, or foundering, which is where this bone does one or two things. It either sinks, so it rotates downward, that's bad, or the whole column just sinks straight down. Both of those are bad situations. She has neither, so that's good for Maggie. And again, her navicular bone's here. I don't see any areas of infection in this bone. This round hole here is a vascular channel. That's normal. So don't be confused by that. She's got a little arthritis in this coffin joint as well. And the front to back view of her right hind. Again, this coffin bone here, short pastern, the end of her long pastern bone. And all of this looks okay. You can see she's a little bit rough out here on the outside and the inside of that coffin bone, but no real areas of bad infection. Anybody have any questions? Everybody confused enough?
She should heal up pretty fast. Just be good to go.
Well, it takes horses are different, but on average, it takes about 9 months for the hoof to grow from the cornet band to the ground. So this big defect that they made, well, she started it, and we're just cleaning it up, or the guys at the farrier school are just cleaning it up. That'll take about 9 months. Some horses are a little longer, up to a year, 14 months. Some can grow hoof pretty fast, but it's going to be a while before that hoof looks normal again. What we hope doesn't happen is the same thing. We hope that the right hind doesn't do the same thing to the left hind. It may, but probably not. Probably not. Generally, when they rupture abscesses, it drains for several days and then it heals back and they're fine. So probably what happened in her left hind is not going to happen in her right hind, but I would imagine that's what started her left hind doing what it's done already. She just got infected and the hoof wall became unattached from the healthy tissue and the bone under it. It's kind of like if you smash your fingernail with a hammer and it turns black, and eventually it's just going to come off because it's detached. And that's kind of what's happened in her case.
Did it break right where the pyramidal process is, right in the front?
No, she did not.
Where'd she, on the right hand, where'd it break open?
It broke off lateral
Just lateral to it, because she was
core.
sore. We looked at her about 3 hours ago, and she was real tender right there,
Yeah.
right in the front.
Well, you can see it.
Yeah.
If you peel her hair back, you can
Yeah.
see just
Just
to
a
the
little
lateral
crack.
aspect of midline.
Because she's been on the SMZ and Butte since last week.
Gotcha.
And so it kind of helped probably,
Yeah.
you
Yeah.
know, take some pain off and get to break out the top.
Absolutely. Yep.
That whole ankle was swollen also.
And they
so,
do that. Yeah, they'll do that. They just swell up the legs. Sometimes you'll see, especially these draft horses, where they get infection in the foot. Some of them will swell all the way to their knee or the hock.
Yeah.
You know, get big cellulitis type situation.
That's funny because that morning she was normal on the right rear. They come to trim the left, she come out of the stall lame on
Yeah.
the right rear.
Yeah.
And so it happened that fast, but it's been going on longer than that.
Yeah.
Yeah.
You just get to the straw that breaks the camel's back as far as the pain goes. They can deal with it, deal with it, deal with it, and then you get to that threshold and they can't deal with it anymore. She's all right. She's, as my granddad says, she's had worse than her eye. She'll make it. And I don't, you know, the reason is, well, why is she abscessing? It's just some horses, I think, if you can't, sometimes you can't pinpoint why they do it. Why they do it.
Do you all have any questions for Dr. Johnson while he's still here?
Yeah, how were you able to tell that she had arthritis from the x-ray?
Well, arthritis, the definition of arthritis for you, for a horse, for a dog, is loss of the cartilage in the joint. So your joints normally have cartilage that make it really easy for your bones, the end of your bones to slide together. I think the comparison I heard is in a normal joint, it's about 1/60th the friction of a ice skater's skate on the ice. So pretty free, no friction. You start losing the cartilage and it doesn't work so good. So that's the definition of arthritis. Now, why do I say radiographically she's got arthritis? You can't per se see cartilage on x-rays. You see white bone and you see black. That's the cartilage, but it's just a black space. You can't per se see the cartilage. You can see the space that the cartilage is taking up. But what they do, just like humans, dogs, when you get arthritis, the body's response to arthritis is to decrease the amount of motion that the joint goes through. Because if a joint doesn't move, it doesn't hurt. Okay? So what the body does, and generally unsuccessfully, unless you have years and years, it tries to build bone around the joint to solidify it. And that's what happens. That's why you get spurs or little pieces of bone, like my knees, or I have arthritis in both knees, and I have little bone fragments in my knees. But that's just from the joint building bone around, trying to solidify it, and those spurs break off sometimes and make little pieces of bone that are in the joint. Does that make sense?
Yeah,
Did I
so
confuse you?
she's kind of, so
She
she's trying
has
to
that.
grow bone.
Yes, she is trying to grow a little bit of bone right here where the joint capsule attaches.
Oh, yeah.
Which is right here. You see this little place right there?
Yeah.
So it's not bad. It is not significant arthritis or
Yeah.
a sign of significant arthritis. But she does have some. But she's an older horse. She's probably, I don't know, 10 or 12. How old is she? 9?
About, I think she was 10.
10?
Right, 10.
But, that. Anybody else?
Any other questions?
None? Hey guys, what do we say? Because they made a special appointment to come over here and help us out today and help us take care of Maggie.
Thank you.
You're very welcome.